Let's talk about intrauterine contraceptives, about their design and peculiarities of their use. These contraceptives have been used for a long time. At the moment, T-shaped IUDs are used most often. That is, they have the shape of letter T. There are also circle-shaped models. I will show you. Here is the circle-shaped IUD, with a central stem on which copper wire is placed. There are also phi-shaped contraceptives. This IUD has a shape of a Greek letter phi. I will repeat once again that the most common models are T-shaped IUDs. What are they like? A small anchor which has horizontal arms, a vertical stem, copper wire is placed on this vertical stem or other metal wire, as well as the thread in order to control the position of the contraceptive in the uterus and to remove this IUD. The weight of contraceptives is from 0.5 to 0.6 grams. The metal which is used is mostly high-purity copper. In order to increase the term of use of contraceptive, this metal wire may also contain gold or silver. The correct position of contraceptive in the uterine cavity. The horizontal arms are situated close to the fundus. Their ends, so-called olives, are situated in the area of tubal angles. The central stem is along the uterine axis. Please pay attention to the fact that the contraceptive is completely placed inside the uterine cavity. There should be some distance between its lower point and the area of internal os. It's obligatory. In case of such position of contraceptive, the IUD will be placed correctly. It will fulfill its functions, and there will be the minimum risk of development of complications. It was the correct position of contraceptive. Now I will try to show you the wrong position of it. You can see that the contraceptive in this situation is placed rather low. The horizontal arms do not reach the uterine fundus, and the central stem is even embedded into cervical canal a little bit. This condition is called partial expulsion. It is diagnosed rather easily. You just need to do the ultrasound investigation. You will see that the central metal stem will be in the cervical canal area. In this situation, this IUD must be removed. What should be done in order to insert the IUD correctly? Now let's talk about how to prepare the contraceptive for insertion and how to insert it. There are also so-called tubes in order to insert the contraceptives. Sometimes they even called syringes. This is contraceptive Yunona Bio-Multi. As you can see, this is the tube. There is a stopper on it in order to mark the depth of contraceptive insertion, and that's all. There is no plunger in it. If we take a T-shaped model or circle-shaped model, it's all the same, but there is one more detail. It's called plunger. Here is a T-shaped model. A plunger. By the way, how should we open the packaging? Here, do you see it? The manufacturer of the packaging made such a little pocket. I don't know how it's called correctly. The packaging of contraceptive is open. The procedure of contraceptive insertion. The preliminary steps are the following: clinical examination, laboratory examination, in order to exclude the contraindications to the use of this method. The procedure of the insertion is carried out on an outpatient basis. It can be also performed in a hospital setting, but in general it is done on an outpatient basis all over the world. The patient is on the gynecological chair. You carefully treat the mucous membranes of the vagina and cervix artery with antiseptic solutions. It's necessary to remember that there should pass some time from the moment of treatment of the mucous membranes with antiseptic before its antiseptic effect will start. If it's an iodine-containing solution, it's minimum 3 minutes. Then you should carry out the probing of the uterus in order to determine the length of the uterine cavity. That is, the length of the uterine cavity will be found during the probing of the uterus. It's not really a probe that I'm holding, but you can understand the principle. Here is the depth of contraceptive insertion. After you've done that, the contraceptive is still in its packaging. This is a so-called no-contact technique of preparation for insertion of contraceptive. You hold the threads, they are rather long and very durable. You wind them a little bit around your finger, and as you can see now, I start drawing the arms of the IUD into the tube without taking out the IUD from the packaging. I will show you closer now. Do you see it? The arms are horizontally drawn inside the tube. I didn't take out the contraceptive from the packaging fully. After that, I place the plunger inside. That's the contraceptive is ready for insertion. The procedure of insertion. It's clear that you need bullet forceps. You need to align the angle between the cervical canal and the uterine cavity. The contraceptive must be inserted till uterine fundus. Here, do you see it? You bump into the external os area with the stopper. After that, I will put it like that. You hold the plunger motionless and you sort of try to put on the tube on the plunger. The horizontal arms of contraceptive are released. Here, it's fully released. Then comes a very important moment, the removal of the plunger. First you take out the plunger, then the tube itself. Why? Because otherwise the thread may be caught between the tube and the plunger. And you may dislocate the contraceptive from the correct position. Here it is placed correctly. How to remove the contraceptive? Let's see what's happening to it. You will cut the threads, then we pull by the threads. What happens next? The arms of the contraceptive start folding. And in such folded position, the contraceptive is removed from the uterine cavity. It's the insertion of a T-shaped model, so-called method of withdrawal. Let's repeat once again. In order to take the IUD out of the tube, the plunger should be motionless, and the tube is sort of put on this plunger. There are insertion systems in order to simplify the procedure of insertion, make it controlled and correct. I'm holding an insertion system of this design. Probably you've also encountered Mirren insertion systems. Preparation of contraceptive for insertion. There are figures 1, 2, 3 on the frame of the system. What happens? You take the system and move this knob from position 1 into position 2. As you can see, the arms of the contraceptive are drawn inside the tube. In order to insert the contraceptive, you insert the IUD to the depths which you've marked. And then we move the knob from position 2 into position 1. Have a look, the horizontal arms are unfolded. This mark is situated opposite the figure 1. Then we move the knob to position 3. There is one very important moment here. I will try to show it. You should bump the slider into the lower part like that. Then the contraceptive will be released from the tube. If you don't move the slider till the end, you will simply take the IUD out of the uterus. Once again, from position 1 to position 2, the contraceptive is ready for insertion. You insert it into the uterine cavity, move into position 1, the horizontal arms are unfolded. You can move the contraceptive a little bit up, sort of closer to the uterine fundus, if there is such a necessity and if you feel that it needs to be done. And then you move the slider till it stops. The insertion of circle-shaped models of contraceptive. The preparation of contraceptive here in principle is not needed. You just take the IUD from its packaging, set the stopper for the needed depth, then the IUD is inserted into the uterine cavity. You can see how it starts to deform. Then you pass through the cervical canal. It's placed inside the uterine cavity. In order to release the anchor, the procedure is the same. You keep the plunger motionless and move the tube till it stops. Then we take out the plunger, take out the tube. The contraceptive is in the uterine cavity. Here it is. Removal. We pull the ring, it's deformed, it enters the cervical canal, and then you take it out. Okay, now we have to insert the contraceptive of multi-load type. It's also an IUD, which doesn't have any plunger. Here is the stopper. How do we insert this IUD? The arms are deformed, they are pressed like that to the tube. Here it is inserted into the uterine cavity. And then, owing to its configuration, horizontal arms hold on to endometrium in some places. And the contraceptive is inserted like that into the uterine cavity. The removal of this contraceptive. We start moving it through the cervical canal. You can see how the arms are deformed. They are sort of stretched. Here it is. I've removed it. In order to make the procedure of insertion and removal of contraceptive safer and less painful, it's better to do it during the menstruation, but in general, the contraceptive may be inserted and removed on any day of menstrual cycle. The main condition is the certainty that a woman is not pregnant. So there are 3 different in-shape anchors of intrauterine contraceptives: T-shaped, V-shaped, and circle-shaped. They all have their own peculiarities of insertion. From my point of view, the use of such insertion system is most acceptable, because it makes the procedure of insertion more convenient for the doctor. It takes less time and doesn't require any external assistance. I hope that this information will be useful for you. I wish you and your loved ones to stay healthy.